The month of October is dedicated to breast cancer awareness. It is observed worldwide to increase support for awareness, detection, and early treatment, as well as palliative care of the disease. Today on Sound Health, we will dispel myths and misconceptions about cancer. I'm Olatunji Agunbiade. Welcome to the show. It's still Sound Health on Lagos Television, and today we will try to dispel some myths and misconceptions about cancer. And I have with me Dr. Temitope Olatunji Agunbiade, a consultant clinical radiation oncologist. Welcome to the show, doctor.
Thank you for having me here. Okay.
To start with, is cancer a death sentence?
Oh no. Cancer is not a death sentence. It's rather unfortunate that this myth has been ongoing. You diagnose patient and you tell them they have some form of malignancy, which is cancer, and the next thing they say, that's a death sentence. It's not a death sentence at all. You can actually cure some cancers. What will tell the treatment outcome? It's the state at which the patient presents, the type of cancer it says, the degree of differentiation, the kind of the tumor biology the patient has, and availability of treatment, funds, and basically those are the major things that you say would give us a treatment outcome.
Okay.
So it's not a death sentence.
Is it contagious and hereditary?
Cancer is not contagious. However, there are certain viruses that predispose to it, like the human papilloma virus in cervical cancer, and Epstein-Barr virus in head and neck tumors, the hepatitis B virus in hepatic malignancies, and the primary liver cancers. So it is having those viruses. The viruses, they cause some form of transformation, malignant transformation, and that's maybe that's why people say those things cause malignancies. But however, it's not it is not that they cause cancer, but the effect. Of course, some cancers are hereditary. All right, you can have some cancers in the family, okay? Depending on the kind of cancers it is. Like, okay, let's say for breast cancer now, if somebody in the family has a history of breast cancer, we usually do screening. We need to monitor them closely. You need to monitor the girls in the family, all right? And that's as a result of some genetic mutation, okay? So you can say that there can be some form of familial causes of cancer. However, it is not common. The commonest cause of cancer is, or rather should I say, the ones that we see commonly are the ones that just occur spontaneously. Some of them you don't even have previous history of cancer in the patient or previous history of cancer in the patient's relatives.
Okay.
All right.
Okay, doctor, during treatment, does chemotherapy or biopsy increases the spread of cancer in the body?
That is another myth and misconception that we need to debunk, okay? Chemotherapy or biopsy are supposed to help the patient. Okay, let me start from biopsy. You need to get a tissue diagnosis. If you don't biopsy the tissue, you cannot get a diagnosis. And the only way to do it, they go in, take a bit of sample, ultrasound guidance, they take a bit of sample and run some investigations on it. We call it histopathology and immunohistochemistry. So that will help us to know what kind of cancer it is. It will give us the grade of the disease. That will tell us how aggressive the kind of disease is. It will also help us to manage the patient better, because management of cancer has just gone beyond, it's global basically. It has gone beyond seeing a patient in one room and just doing something ramshackle, all right? Management of breast cancer is standard. There's certain investigation you have to do, particularly the immunohistochemistry. It will tell you what kind of it will tell you the tumor biology, and that will help us. Is it HER2 positive? Is it hormone receptor positive? Is it negative? And at the end of it all, it will give you a better prognosis if you know what it is and you start early.
Okay, are there side effects
of chemotherapy?
And is it painful?
I hear this all the time. Oh my goodness. As a matter of fact, ignorance is not good at all. I do a lot of counseling in my office. I will not say chemotherapy is painful. It is not painful. However, it does have its own side effect. Okay? And those side effects, they may vary. All right? What basically happens is this. Those patients, some of them come and they tell the ones at home that what you read online is this, is that. Imagine a patient that has a breast cancer with a different tumor biology telling another patient, somebody that is HER2 positive that needs trastuzumab or Perjeta is telling somebody at the reception that there's one tablet doctor used to give me, which is an hormone receptor blocker. Imagine somebody on tamoxifen telling somebody that is hormone receptor blocker, telling somebody that is HER2 positive that this is what they are supposed to give. So, as I was saying, it is not painful, but there are side effects. Those side effects can be covered. All right, like if the patient are going to take chemotherapy, we pre-medicate them. Some of them, you have to give them antihistamine because of some of the side effects. And also, we prepare them enough for the chemotherapy. You tell them to go do series of investigation like echo. Now you want to know the ejection fraction. Can the heart tolerate the chemotherapy? Some of them, their side effects are cardiotoxicity, some nephrotoxicity. So you want to know if this patient can tolerate the chemotherapy you want to give them. So you do adequate pre-workup. All right. If like for echo now, I said I want to know the ejection fraction. If it's below the normal value or we find any abnormality, we gently move away from any cardiotoxic drugs. All right. Also for the nephrotoxicity, which is the renal kidney toxicity, those patients would have done certain investigations for them, and after doing those investigations, if we see derangement or anything, we shift away from drugs that can cause nephrotoxicity or that on the long run will damage the patient's kidney. So adequate pre-treatment investigation is mandatory. So when you do that, it will also guide us. Okay. Then also we give them anti-reaction. We give them anti-reaction to suppress whatever reaction that may come up. Although we have to counsel this patient as well. Proper counseling is very, very important. If you don't counsel them, they may run away. But explaining to them that, okay, they've heard so many stories about chemotherapy. If we tell them that, okay, well, I'm going to pre-medicate you, I'm going to give anti-reaction before you start, like some class of drugs, and the ones I mentioned that are cardiotoxic, we'll give them some medication to lower those side effects. All right, we'll give them a day before when they come for the chemotherapy. We'll still put it in some infusion. After that, then after the chemotherapy as well, you still give them some anti-reaction, anti-allergy and all that, so that we'll tell them to take it for like minimum of 5 days, because the first 5 days is usually the acute period where you see maximum chemotherapy side effect. So you would have covered those days. And also there's something they call GCF. All right, we give it so that the white, you know, the white cell, the white blood count, all right, they are the body fighting soldiers. All right, I mean, they come to play, they have their own role to do as well. So when you take chemotherapy, when the patient take chemotherapy, certain things that can occur that we look out for in the blood. I mean, there's certain parameters. We look out for the white cell count, we look out for the PCV, we look out for the platelet count. All right, so under the white blood count, the neutrophil count, it's very important. We monitor it. So there's certain drug that we also give, all right, at prophylaxis after the chemotherapy, because we know that those things may go down from myelosuppression. Where do we form blood is in the bone marrow. All right, and you know, a side effect of chemotherapy or radiation is myelosuppression. Anything can happen. Any of those 3 major things that I mentioned now, they can go down. So if they go down, we need to make sure that the patient is covered, and patients they don't have any major effect. So by the time you explain all this to patients, you tell, so they will know that the benefit outweighs the side effect or possible problem that may come up. And you tell them that after your chemotherapy, we're going to give a certain day. But however, if you have any discomfort, any complaints, please come to the hospital. It doesn't matter if you came yesterday, took chemotherapy, and you don't know how you're feeling, or you start stooling, or you think the vomiting is not stopping. Please come to the hospital so that you don't get tired.
Does finding a lump in your breast means you have cancer?
Not at all. All right, not all lumps that you find are malignant. Okay, not all lumps are malignant. You have to, I mentioned something about tissue diagnosis. All right, they need to go to that lump rather. They do ultrasound guided biopsy, which is the gold standard. You do an ultrasound guided biopsy, and they go there, take a little bit of sample, and run it through some investigation. And when they do that, it will guide us. Some may come out as benign, some may come out as malignant. Okay, so when they are malignant, we'll go an extra mile to know what to do. Even the benign ones, if it's not so big, we may not worry. But if it's big and the patient feels uncomfortable, we'll just go in and remove it.
Dr. Olatunji Agunbiade, does mammography increases your risk of having cancer? Some will tell you because you're going for the test. Because they feel it's radiation. Yes, and all that. That one needs to dispel anyway, so that people won't start running away from doing the regular screening that they are supposed to go for. It's some form of radiation anyway. However, I mean, the dose is still a diagnostic tool, and not something that would cause cancer. Are you getting what I'm saying? But it is mandatory for people over 40 years. All right. For people less than 40 years, we recommend ultrasound scan. Okay. But if they are over 40 years, we tell them to go for mammogram. And I'm sure that from previous researches done, if it was that bad, we will not tell, doctors and researchers will not encourage patients to go ahead to do it. Okay. All right. Are there chances that cancer will return even after treatment?
What I used to tell people is that treatment of cancer or treatment outcome depends on the stage of presentation. It depends on how aggressive that disease is, all right? And it also depends on adequate treatment, all right? And having the professionals to work with is also very important. There are many quack centers now that we see here and there. And when some patients come in, you begin to wonder, You said you got treated. What happened? You know, you see some mastectomies are not completely done and patients have recurrence on that area. However, a stage 1 and stage 2 disease, you can achieve cure. All right. Also, I mentioned that the degree of differentiation, which tells us about how aggressive that disease is, matters a lot. If it is an aggressive disease, it doesn't matter if it's a stage 2. After treatments, it may or may not reoccur. All right. A stage 3 disease is one in which that they have to downstage to like stage 2 or thereabout, so that it can, if you are lucky and it's a good differentiation, a well differentiated disease, of course you can achieve a cure. But if a patient comes in stage 4, which is a metastatic state, unfortunately this is what we see most often, and it's really very depressing when you see some cases like that and you are wondering, where have you been? Where have you been with something massive like this? Or you see a patient with autoamputation. Autoamputation is one in which the breast on its own just disappears in the chest. Yeah, we see some patients like that. The affected breast sort of disappears as if it cuts itself off. And you're like, where have you been? Or you see patients that they can't breathe or they have fluid in the lungs, but you're like, what has been happening? But some, it's not their fault, because some just come up like that and they're not sure they had the disease until it became metastatic. All right. So the ones that we see majorly are stage 4 cases. Such kind of cases, you cannot achieve cure. For those cases, their treatment is palliative. All right. So Lord have mercy on our patient. We pray that we see them early. So if we catch early cases, there's a high chance of curing the diseases.
Will eating sugar make your cancer worse, or will artificial sweetener predisposes you to cancer?
I wouldn't say yes, because my reason is this. It is known that cancer cells, they consume sugar a lot. They like sugar a lot. All right. And you get to hear this. Our patient will say, doctor, I've stopped eating sugar. The world is global and everybody goes online, they read all sorts of things. So I tell, eating sugar or reducing it doesn't really count. But there is a major but. We all know that sugar predisposes to obesity. I mean, there's obesity, there's all that, you gain weight, which weight gain and all that, they are major risk factors for breast cancer and even for other cancers too. Okay, so you know, if you eat sugar, you will gain weight, and by gaining weight, it predisposes you to cancer. But that sugar itself causes this one, it's a myth we have to dispel. But you know that if you eat sugar, cancer cells, they love sugar. So it's left for you now to say, okay, I'm not going to eat sugar, I don't want to gain weight so that it will not predispose me to having cancer.
Does smoking or some lifestyle predisposes you to cancer?
I mean, there are established predisposing factors. So majority of the cancers, apart from breast cancers, smoking, alcohol, environmental exposure to even to dust, you'll be amazed in some head and neck cancers. Okay, alcohol basically is not good for breast cancer. Smoking is not good. For oral contraceptive use is not good. Then sedentary lifestyle. You stay in one place, you don't move around, you are gaining weight. I still come down to gaining weight. You are gaining weight and all that. As you are gaining weight, it is not helping you. That's even by the way. As well, lifestyle as well. Multiple sexual partners and all that, they predispose patients to exposure to human papilloma virus, and you know what, that also is a major risk factor for having cervical cancer as well. So lifestyle is modification of lifestyle is actually very important.
Okay, doctor, I would like you to shed more light on the use of oral contraceptives or any other contraceptives.
Estrogen is a fuel for breast cancer, all right? And what is in those oral contraceptives? They are hormones, all right? Those hormones they predispose to it. All right, so we usually tell patients that particularly breast cancer, it's a major risk factor. It is a major risk factor.
Does one's attitude or well-being, being positive or negative, put you at risk of having cancer?
No, no, it really doesn't. It doesn't at all. But if for our patients, having a fighting spirit goes a long way. All right, some patients are fighters. You will see them, they will come. By the time you even see them, you're already encouraging other patients. If you have that attitude, a fighting spirit, there's 99% that you come out victorious. You get what I'm saying? Although the type of disease they have, the other factors I mentioned will also determine the outcome. But having a positive spirit is actually very good. It's a plus, not a minus, to having a good outcome.
Okay. That has been Dr. Temitope Olatunji Agunbiade, consultant clinical and radiation oncologist. She has been dispelling some myths and misconceptions about cancer. We'll bring you the concluding part next week. Sound Health continues with trending and home essentials. Please stay with us. Early detection is key in beating cancer. Consult your doctor today. Hope you've been able to dispel some myths and misconceptions about cancer. This is why we say thank you on today's episode. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at TLTV Social. #Sound Health. A sound health is a sound mind. Make healthy living your choice.